Hello, friends, or new friends, if you're just catching up with us. My name is Leah. I apologize for the weird sound in my voice, but I'm currently battling a cold or something. I don't know. I do have a weird immune system, so I get sick a lot. And I have a bruise from the recycling bin on my arm. So, anyway, I wanted to give you a quick update. Some of you have been following along for a while, so you know what's going on. But for others of you that are just joining us here on this journey, I have a 2-year-old son and a 3-year-old son that are both showing signs of pes cavus, which is arched feet. My 3-year-old son, Boss, has pretty severe arched feet. So his feet go like this. I mean, you can't really tell when he's being like doing normal kid stuff, but if he's barefoot and you see his feet just sitting there, you're like, oh, your arch is really pronounced, and it's on both feet. He also has apraxia of speech, which means he wants to talk. He's not on the autism spectrum, but he cannot talk. He can say a few words, but he's kind of trapped in, like, the motor neurons are not firing to tell his mouth how to make the sounds he wants to make. So he can say the word happy, he can say mom, he can say eat, he can say no, he can say yeah, he can say boo. Beyond that, we're doing speech therapy, occupational therapy, physical therapy, all the things. That said, in January, early January, we did his 3-year-old visit with his pediatrician. I talked to her about the concerns I was having with his feet kind of being like this, and they seemed like hard, like the bottom of his foot is just kind of hard to the touch. And she immediately sent us to a pediatric orthopedic doctor. We saw him within a week. He took x-rays, looked and touched the feet. His feet kind of like won't go like this. Like if this is his ankle, his foot won't dorsiflex like this very well. And so he often face plants. Like he'll just be running or walking and just like, because his feet won't go up. Like his ankle doesn't pull his feet up like they should. So the orthopedist looked at that, took x-rays, and immediately was like, y'all are going to have a brain and spine MRI because this is likely a progressive neurological condition. You're going to then see the neurologist, and then you're then going to see genetics. And so, gosh, sorry, excuse my cold, and this long video, but anyway, so this was early January. We set up the appointment. The soonest available for the MRI on his brain and spine is almost the end of April, which we're now approaching. We're now 4 or 5 days away from his brain and spine MRI, which is a sedated procedure, which requires general anesthesia for 3-year-olds. And so this procedure is going to cost $27,913 and like 60 cents or something, which, another story. But that procedure takes place on Wednesday. He will be under anesthesia, and they will take an MRI of his brain and spine. From there, if anything shows up, we'll find out what shows up. We then have an appointment with a neurologist over a month later, and genetics is in late August. Those are soonest available at our preferred provider. So it's a lot of waiting, And the thing is, when your 3-year-old has bilateral pes cavus, which is on both feet, high arches on both feet, it is often a progressive and often a neurological condition. And so we are looking at possible diagnoses of things like cerebral palsy, muscular dystrophy, spina bifida, CMT, which are all progressive. And most of them are, the kind of progressive that, like, he could be in a wheelchair by his teens and then lifespan in his 30s. Or he could, if it's CMT, he could, just have pain the rest of his life, but have a normal lifespan. So, or it could be, it could be a tethered spinal cord, which is actually kind of what I'm hoping it shows up to be, which sounds odd, but tethered spinal cord could be resolved probably through surgery, where they just clip the spinal cord and then it fixes most of the symptoms and we're good. Like, maybe another surgery later, but it's a solution. Like, it's not like a death sentence. It's like we're gonna fix this, we're good. And so I'm actually like hoping, in a strange way, that my kid has a tethered spinal cord, which is a bizarre thing to hope. So, but that would maybe be best case scenario. I don't know. The only problem with that is that my 2-year-old is starting to show the high arches too, which we've checked. He's also seen the neurologist and the genetics doctors, but he doesn't require an MRI at this point because they're not progressed enough to require an MRI. So, and then I have a 12-year-old stepson who has been having some leg pain too, has a cafe au lait spot, which is kind of like a brown birthmark spot, which is indicative of NF1. And so at this point, my mom brain is also thinking this could be a like hereditary familial thing where possibly both of my sons, as well as my stepson, all 3 of my sons, sorry, I don't know how to say that, my 3 sons, including my bonus son, sweet boy, could have some sort of related genetic condition. So, there's like, gosh, sorry for all the sniffing. And the, I swear this is from a recycling bin, guys. Anyway, there's a lot going on. And so thank you for listening. If you're still listening after 8 minutes and 28 seconds, wow. But this is what's going on. And, we've been waiting for this MRI for months and months. It will probably be more waiting after this. And so, like, I'm excited to get it done. I'm also, like, realizing that this is the before. We're living in the before. Whatever diagnosis or non-diagnosis we get, this is the golden age, like, before we could find out really bad news. So, I'm trying to enjoy my kiddos. I'm trying to not lose my mind as a mom, and change diapers and do the grocery shopping and all that kind of stuff, and get over this cold and have this like looming. So I don't know anything yet. We may not know anything on late Wednesday, the day of the MRI, but this is where we are. And anybody else that may be going through something like this, I just wanted you to know that this is what's happening here. And thank you so much for all the kind words and messages I've gotten so far. I really appreciate y'all. Thank you.